They're painful, exhausting, messy, and something women have to deal with. Yeah, you know what I'm talking about, periods.
Yep.
But for women who have particularly heavy cycles, there is a procedure that can make them more manageable.
Yep, yes there is, Sherry. CBS 21's Lyra Greenberg explains in this week's Doc Talk.
The OBGYN I spoke with told me many of her patients pray for menopause. They even consider having hysterectomies just because their periods are so severe. So I was shocked to learn there's a procedure that's safe, quick, and manages heavy cycles. After Gretchen Ramsey had her second child, her period seemed to take control of her life.
Being caught off guard in those situations was extremely embarrassing, not to mention exhausting and tiring.
It became so severe
That December, there was not one day in December where I did not have my period.
Ramsey decided to take back control. She called her OBGYN.
We talked about several options, including medication that that I would have to be on for an extended period of time, and I just didn't feel comfortable with that option.
That's when Ramsey learned about endometrial ablation.
It's a procedure to destroy the lining of the uterus so that a woman who is having a problem with heavy menses can get relief from that without having to have a more major surgery like a hysterectomy.
Destroying the uterine lining results in a much lighter period. For some, including Gretchen,
I have not had a period since.
often symptoms including bloating and cramps will remain. In fact, Dr. Manning says this procedure should not be used for managing cramps. It's more for flow. She also typically won't perform it on women under the age of 40 because the younger the patient, she says, the less effective the procedure. And it can be an issue with pregnancy.
It is possible to get pregnant after having had this done, although that is not advisable because those would be very high-risk pregnancies.
But Gretchen already had children and was able to use this as a lesson for her daughter.
Now I'm able to sort of help my daughter understand a little bit about the procedure, why I went through it, and the health benefit that it brought to not only me but to our whole family.
Dr. Manning says the procedure has gotten more advanced in recent years. It takes just a few minutes and is done with a small device. Recovery, just a couple of days. With this week's Doc Talk, I'm Lyra Greenberg, CBS